Good morning, Mr. Chairman, dear colleagues. First of all, I would like to thank the organizing committee for inviting me to give a talk in the Apostle Oncology 2021. My topic is changing epidemiology of hepatocellular carcinoma in Taiwan. My COI are shown here. I will give a brief introduction, then talk about the prevention of hepatocellular carcinoma in Taiwan, including the primary prevention, secondary prevention, and tertiary prevention, changing epidemiology of hepatocellular carcinoma in Taiwan, and make a summary. Taiwan is a hyper-endemic country of HPV and HCV infection. The prevalence of HBsAg is about 15 to 20% in adults. The overall anti-HCV positive rate in adults is 4.4% in Taiwan. The prevalence of anti-HCV in northern Taiwan was 1 to 3%, but the prevalence of anti-HCV was 5 to 10% in southern Taiwan. In addition, there are several HCV hyperendemic townships with anti-HCV prevalence higher than 15% in southern Taiwan. One-third of the patients with chronic HPV infection will proceed to chronic hepatitis. 15 to 40% of patients with chronic hepatitis B will develop liver cirrhosis or hepatocellular carcinoma. 60 to 80% of the acute hepatitis C infected patients will become chronic hepatitis. 20% of chronic hepatitis C will lead to liver cirrhosis in 20 years. After the development of liver cirrhosis, the annual rate of hepatocellular carcinoma occurrence are around 2 to 7%. Therefore, hepatocellular carcinoma is one of major health problems in Taiwan. For the primary prevention for HPV-related HCC, HPV vaccination and raising the awareness of people are necessary. Taiwan government started the mass hepatitis B vaccination program since 1984. Infants born to HBsAg positive women were given a hepatitis B vaccine, and all the newborn received HPV vaccination after 1986. The coverage rate of HPV vaccination increased to 98% in 2018. The prevalence of HBsAg declined from 9.8% to 0.4% in 35 years after mass hepatitis B vaccination program. There was a continuous decline in HCC mortality rate and incidence for birth cohort born after implementation of the HPV vaccination program. The mortality rate of HCC decreased 90% and the HCC incidence decreased 80%. Because of lacking effective vaccine, Taiwan government adopted the policy of treatment as prevention to prevent the occurrence of HCV-related HCC. The National Health Insurance reimbursed the treatment for chronic HPV infection since 2003. PEG interferon and NUCs were used for treating the patient with chronic hepatitis B and HPV-related liver cirrhosis as a secondary prevention for HPV-related HCC. Taiwan National Health Insurance reimbursed the treatment for chronic hepatitis B infection since 2003. Both PEG interferon and NUCs are reimbursed as a first-line therapy. Retreatment is also allowed for patients failing to previous treatment. The result from a multicenter clinical trial in Taiwan demonstrated that interferon-based therapy decreased the occurrence of HCC in chronic hepatitis B patients, especially in patients with liver cirrhosis. The retrospective nationwide cohort study, by using the data from Taiwan National Health Insurance Research Database, demonstrated that NUC's treatment was associated with lower incidence of HCC development in patients with chronic hepatitis B. The hazard ratio was 0.37. NUC's treatment in HBV-related cirrhotic patients also showed a similar result in this multi-center study led by National Taiwan University. Interferon, ribavirin, and DAA were used for treating the patient with chronic hepatitis C and HCV-related liver cirrhosis as a secondary prevention for HCV-related HCC. National Health Insurance reimbursed the treatment for chronic HCV infection since 2003. Initially, PEG interferon and ribavirin combination therapy was used as a first-line therapy. Treatment with oral DAA was reimbursed since 2017. Retreatment with DAA is also reimbursed. Sustained virologic response by interferon-based treatment could reduce the risk of HCC development. The cumulative incidence of HCC decreased from 35% in untreated patients to 3% in patients with an SVR. The SVR by interferon-based treatment reduced the annual incidence of HCC by 94% in non-cirrhotic patients and 52% in cirrhotic patients as compared with untreated patients. Treating the underlying viral infection in patients with HBV and HCV-related HCC could be applied as a tertiary prevention for HCC. Analysis based on Taiwan National Health Insurance Research Database showed that the risk of HBV-related HCC recurrence was reduced with NUC treatment following liver resection. The data analysis from the same database also demonstrated that the post-operative PEG interferon and ribavirin treatment was associated with reduced recurrence of HCV-related HCC. The HBV accounted for 80 to 85% in the causes of HCC, while HCV infection was found in 10 to 20% of HCC patients in Taiwan in 1990s. The prevalence of HBsAg and anti-HCV in HCC patients of Taiwan shifted to 60 to 70% and 30 to 40% respectively in 2000s. And the prevalence of HBsAg and anti-HCV in HCC patients changed to 50 to 60% and 35 to 45% in 2015. To prevent HCC occurrence, Taiwan government conducted mass hepatitis B vaccination program since 1984, launched universal health care in 1995, and reimbursed viral hepatitis therapy program since 2003. During the past 40 years, the overall HCC mortality and overall HCC incidence peaked in year 2010 and declined thereafter. The overall HCC case fatality rate consistently declined through the entire period, and the estimated prevalence of HBsAg and anti-HCV in HCC patients were about 50 to 50% after 2010. The HCC mortality and HCC case fatality rate of the young age group continuously declined in the past 40 years, and the HCC incidence of the young age group peaked in year 2000 and then declined. The HCC mortality and incidence declined in age group of 30 to 69 in recent 20 years. But the HCC mortality and incidence in age group of 70 to 84 increased until 10 years ago. The HCC case fatality rate in all age groups consistently declined through the past 40 years. Taken together, hepatitis B vaccination was associated with a 36% reduction in HCC incidence in the young age group. The universal health care reduced the HCC case fatality rate across the overall population. And antiviral therapy was associated with a 15% decline in HCC incidence in the middle age group. In summary, dear colleagues, Taiwan is a hyper-endemic country for both HBV and HCV infection. Because HBV and HCV infection could lead to hepatocellular carcinoma, HCC is one of major health problems in Taiwan. To prevent HCC occurrence, Taiwan government conducted mass hepatitis B vaccination program since 1984, launched universal health care in 1995, and reimbursed viral hepatitis therapy program since 2003. 35 years after the national hepatitis B immunization program in Taiwan, the HBsAg prevalence in children and young adults decreased to 0.4%. There was a continuous decline in HCC mortality rate and incidence for birth cohort born after implementation of the program. Treatment with PEG interferon and NUCs for chronic hepatitis B are associated with low incidence of HCC and sustained virologic response by interferon-based treatment in chronic hepatitis C patients decrease the development of HCC in time. Reduced risk of HBV-related HCC recurrence was found with NUC treatment following liver resection. Post-operative PEG interferon and ribavirin treatment was also associated with reduced recurrence in patients with HCV-related HCC. The prevalence of HBsAg decreases approximately to 50%, and the prevalence of anti-HCV is about 40 to 50% in HCC patients after 2010. Taiwan government aimed to eliminate the HCV infection before 2025. Therefore, the incidence and mortality of HCC will be further decreased in the near future. Thank you for your attention.